Infectious disease. Infectious diseases kill more people worldwide than any other single cause. Infectious diseases are caused by germs. Germs are tiny living things that are found everywhere, in air, soil, and water. You can get infected by touching, eating, drinking, or breathing something that contains a germ. Germs can also spread through animal and insect bites, kissing, and sexual contact. Vaccines, proper hand washing, and medicines can help prevent infections. There are 4 main types of germs. Bacteria. One-celled germs that multiply quickly and may release chemicals which can make you sick. Viruses. Capsules that contain genetic material and use your own cells to multiply. Fungi. Primitive vegetables like mushrooms or mildew. And protozoa. One-celled animals that use other living things for food and a place to live. Infectious diseases spread through 2 types of contact. Direct contact. An easy way to catch most infectious diseases is by coming in contact with someone who has one. This someone can be a person, an animal, or for an unborn baby, its mother. Indirect contact. Disease-causing organisms can also be passed along by indirect contact. Many germs can linger on an inanimate object, such as a tabletop, doorknob, or faucet handle. When you touch the same doorknob, grasped by someone ill with the flu or a cold, for example, you can pick up the germs he or she left behind. If you then touch your eyes, mouth, or nose before washing your hands, you may become infected. Some infections occur from organisms that naturally live in the environment but are not passed from person to person, like fungal infections or bacterial infections such as anthrax. Prevent the spread of infectious diseases. Decrease your risk of infecting yourself or others. Wash your hands often. This is especially important before and after preparing food, before eating, and after using the toilet. Use hand sanitizer when hand washing facilities are not available. Get vaccinated. Immunization can drastically reduce your chances of contracting many diseases. Make sure to keep your recommended vaccinations, as well as your children's, up to date. Use antibiotics sensibly. Only take antibiotics when necessary, and if they're prescribed, take them exactly as directed. Don't stop taking them early because your symptoms have gone away. Stay at home if you have signs and symptoms of an infection. Don't go to work if you are vomiting, have diarrhea, or are running a fever. Don't send your child to school if he or she has these signs and symptoms either. Cover your cough and sneeze. Coughing can spread germs through the air. By covering your cough and sneeze, you can prevent the transmission of germs. Be smart about food preparation. Keep counters and other kitchen surfaces clean when preparing meals. In addition, promptly refrigerate leftovers. Don't let cooked foods remain at room temperature for extended periods of time. Don't share food or drink. Germs may be passed from one to another when sharing of food or drink takes place. Pay special attention to cleaning the hot zones in your home. These include the kitchen and bathroom, two rooms that can have high concentrations of bacteria and other infectious agents. Don't share personal items. Use your own toothbrush, comb, and razor blade. Avoid sharing drinking glasses or dining utensils. Travel wisely. Don't fly when you're ill. With so many people confined to a small area, you may infect other passengers on the plane. And your trip won't be comfortable either. Depending on where your travels take you, talk to your doctor about any special immunizations you may need. Keep your pets healthy. Bring your pet to a veterinarian for regular care and vaccinations. Keep your pet's living area clean. With a little common sense and the proper precautions, you can avoid infectious diseases and keep them from spreading. The role of CDC in preparedness. Preparing people for emerging health threats is one of CDC's overarching goals. CDC contributes to national, state, and local efforts to prepare for and prevent public health disasters before they occur. When a disaster has occurred, CDC is prepared to respond and support national, state, and local partners in responding in order to improve public health outcomes. After response to a disaster has ended, CDC assists national, state, and local partners in the recovery and restoration of public health functions. Throughout history, bacteria and viruses have been used as weapons against people. Many countries have altered various types of illness-causing germs to make them stronger and harder to combat if an outbreak were to occur. The United States government has been planning for such attacks of bioterrorism. The Strategic National Stockpile Program assists state and local government in protecting the lives of citizens across the United States. Many of the steps mentioned before will safeguard you against a bioterrorist attack, using infectious disease as a weapon. But more might be required to combat the disease in those who acquire it. If you are alerted that you have been exposed to a bioterrorism agent, follow local guidelines closely. Listen to local media outlets to get instructions for what to do and where to go for treatment. And if you were not exposed to the disease, learn how to protect yourself and family from exposure. The bioterrorism agents currently planned for are anthrax, plague, smallpox, tularemia, botulism, viral hemorrhagic fever, and pandemic influenza.